Very glad to introduce our work published in iMeta, which entitled Integration of Multiomics with Precision Nutrition for Gestational Diabetes, Study Protocol for the Westlake Precision Birth Cohort. Gestational diabetes mellitus is a common pregnancy complication, and its prevalence has been increased worldwide in recent years. Prevalence of the GDM has exceeded 20% in Asian countries, imposing a huge medical and economic burden. Women with GDM are at an increased risk of developing short and long-term complications for both mother and offspring, such as hypertensive disorders during pregnancy, cesarean section, prematurity, and developing type 2 diabetes. Lifestyle intervention, including nutrition and physical activity, is the first-line therapy for GDM. Pregnancy nutritional status has a substantial influence on health status of the women themselves and their offspring. However, it is also well known that different individuals may respond differently to the same diet or nutritional exposures. So far, personalized glycemic response to diet, nutritional intervention, and its relationship with birth outcomes have not been investigated. The emerging technology of continuous glucose monitoring makes it convenient for us to monitor glucose fluctuation, postprandial glycemic response, hyperglycemic and hypoglycemic status, as well as glycemic variability. Understanding personalized glycemic response of pregnant women to different dietary challenges can be helpful to establish precision nutrition recommendations for pregnant women with GDM, which can further improve the health of these women and their offsprings. Here, we establish a prospective birth cohort, Westlake Precision Birth Cohort, based on pregnant women with GDM, integrating the utilization of wearable device including CGM, objective measurements of physical activity using activity AX3 accelerometer, and multiomics data collection among the participants. This is the overview of our study design. We recruit pregnant women with GDM at the gestational age of 24 to 28 weeks and follow them at the third trimester at delivery and after delivery. Participants receive objective measurements of physical activity and continuous blood glucose for 14 days, keeping timely dietary records during this period. During the appointments, questionnaires, anthropometric measurements, and biological samples such as blood, saliva, urine, and feces are collected. Multiomics measurements such as fecal metagenome, metabolome, and proteome and integration analysis will be performed in the future. At baseline, the participants also receive 3 standardized test meals at 1 day during the CGM recording. We mainly collected the information on demography, lifestyle, dietary habits, physical activity, occupational history, medical and family disease history, feeding practices, and growth and development of the offsprings. Up to October 2022, we have included more than 1,600 participants, aged 31.2 years old on average. The WeBirth provides a new framework for prospective birth cohort study with sophisticated integration of precision nutrition, wearable device, and multiomics data collection among patients with gestational diabetes mellitus. Data from the WeBirth will be a unique resource and will substantially contribute to our knowledge about precision nutrition for GDM management and risk factors of adverse birth outcomes and long-term health of both the mother and their offsprings.